DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hi there and welcome to DocTalk. We're sure glad you joined us today. We're going to have a great show. We're going to talk about pink eye in cattle. My guest today is Dr. Matt Meisner, and he's an associate clinical professor here at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine. It's bound to be a great show. Stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Matt, welcome to the show.
Glad to be here again.
Well, it's always a pleasure to have you here. And folks, Dr. Matt Meisner is a associate clinical professor here at the Veterinary Health Center, and he is boarded in large animal internal medicine. And Matt, we're going to talk about something that's very common in cattle. It's something we see every summer, pink eye.
Right.
And let's start out discussing, what are some of the things that causes pink eye?
Sure, that's kind of, as we discussed before, it's kind of becoming a hot topic about this time of year is pink eyes and problems with cattle in their eye. And pink eye is probably one of the more common ones that we see, and it's an infectious problem of the eye. And actually, there are some specific bacteria that we talk about that cause the infection. But what we find is that we have a lot of other players in the environment that come in to aid them bugs. And this time of year, those things are coming about. Sunshine and dust and things like that.
It's kind of like when we talk to students, tell them there's two reasons animals get sick, either an overwhelming dose of a pathogen or a suppressed immune system. And
yeah.
This is really one of those that is an example of that.
Exactly. Yeah. I mean, in the specific bugs that we talk about causing it, one being the Moraxella bovis, and you'll see that in a lot of vaccines and whatnot. We'll see that bug, and it can cause problems, but it usually needs something to help it get a toehold, and something disrupts the eye or their immune system's poor, and then all of a sudden we start to see this type of infection show up, and it can be pretty devastating and just run wild through a herd.
So when we start to talk about some of the different things that, we talk about Moraxella bovis and some of the infectious agents, what are some of the non-infectious agents that can help set up pink eye or cause something like pink eye?
Irritants. So an irritant such as dust, grass-awns, sometimes composted bedding, sunlight, anything to irritate the surface of the eye or that cornea allows that bacteria that sometimes can be on the eye normally just grab a toehold and then cause this horrendous infection.
What about flies?
Flies, yeah, and flies are irritating. Not only do they disrupt the eye and scratch it up, but then they'll grab it and go right straight to the next one, so they can carry the.
They can carry. Yeah. And we see that with foodborne pathogens like E. coli with flies transmission, and so.
Right.
So they could actually carry the bacteria from one animal to the other.
Yeah, that's right. Some of the way we get these massive spreads through a herd when we have an outbreak is flies and fly control. And they're irritating, and they're just nasty little bugs.
Yeah. Well, I think it's important to understand the bugs. I think it's important to understand the irritants. When we come back from the break, let's jump in and start talking about how we diagnose some of these problems and move forward with pink eye.
Great.
You're watching Doc Talk. We're glad you joined us. We'll be back in a moment.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Rebecca Calder was recently awarded an Amstutz Scholarship. She grew up in Vermont and fell in love with cows at the age of 5. In high school, she spent a weekend with a veterinarian and knew her future was sealed. In college, she received an internship at the Plum Island Animal Disease Center. Rebecca hopes to work in a dairy or mixed animal practice in the Northeast after graduation.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Welcome back to Doc Talk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Matt Meisner, who is an associate clinical professor here at the Veterinary Health Center, and he's also a boarded large animal internal medicine specialist. And Matt, we're talking about what causes pink eye. Now let's get back to, and a lot of people can diagnose or have seen pink eye cases, but let's go through what you see as kind of the clinical signs first of pink eye and different levels of severity.
Well, and we certainly see a lot of cattle sent in with a white eye that may or may not turn out to be pink eye. But the biggest thing about pink eyes, we'll see these kind of very nice centered looking like scars right in the middle of the eye, and they really rapidly spread. The big thing about pink eyes is very painful, so they're tearing a lot, and there's a lot of watering eyes and squinting and trying to stay out of the sun. And then it'll get to where it almost looks kind of abscessed or infected, where you have this kind of white area that kind of spreads across the eye. The surrounding portion of that eye just gets really irritated and angry, and it's very painful. And so at that point, did we get a sticker in it? And there's still a sticker in it.
Right.
Or are we dealing with a pink eye problem that could be an outbreak or kind of some situation that we could do?
You see how these cases can manifest, and some of them get a little bitty scar, and some of them get that pop eye, and is there anything to the severity? Is it more of a calf by calf situation, or
I think you get back to where we talked about before. We get overwhelming dose and individual immune system, and so a lot of their immunity to fight this thing off is in their tears, and some have a more specific immunity to that bug, and these bugs can change rapidly even within an outbreak, to where that immunity that's on that individual calf may not be totally effective, and so we'll see some of them that just have massive infections, and others seem to be status quo for a little bit longer, but. Yeah, there's quite a bit of individual variation.
And we always recommend people work with their local practitioner. What are some of the things practitioners might do to get a better diagnosis of what's going on? Maybe of course we do the clinical exam and the physical exam, but what are some things diagnostically that we might do?
Well, if we're looking for a specific bug, they can culture it. We can take swabs, we can send them to the diagnostic lab, and they can tell us what bacteria, what bug is there, and is it one of these that are pink eye bugs. But I always tell people too to really, every single one that we swab, take your finger and sweep it through the back of the eye and look for grass-ons.
Yeah.
So that's part of the diagnosis is, we're going to find a bug, but we're also going to try to make some other management tools to prevent the risk factors. And hey, we got a bunch of grass-ons. We better get these things out, and then we'll figure out what bug we got. So, a bunch of different ways to do that.
So it can be, what are some of the other differentials that might be on your list?
Oh, we've seen viral things like IVRs and BVDs and, just overall traumas. And in older cattle, we might see some that think they're cancer eyes or different situations, some odd situations. And I've seen white eyes where they were just bacterial infections in the eye. They weren't an eye infection. So there's several different things it could be, but it's pretty
clear.
Yeah, it's pretty clear for the most part.
When we come back from the break, we're going to talk with Dr. Meisner more, and we're going to talk about how to treat those pink eye cases. You're watching Doc Talk. We're glad you joined us, and we'll see you in a minute.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We are having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. TrueTest Group, weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hi there and welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Matt Meisner. And Dr. Meisner is a boarded large animal internal medicine specialist here at the Veterinary Health Center. He's also an associate clinical professor at Kansas State University. We've been talking about pink eye. And we're going to talk about treatment. And before we jump into it, the one thing we always recommend on Doc Talk is that they have a valid veterinary client-patient relationship and that they work with their veterinarian to get a proper diagnosis and plan of attack on treatments. Because as we discussed during the break, there's more than one way to skin a cat on pink eye treatment.
Absolutely, yeah. And I don't really think there's a wrong way to treat them. I think that you're going to find several different methods, and what works for your veterinarian works for your veterinarian because it's worked for your veterinarian. So
Right.
if that's where we want to go, we can stay up with current thoughts and current trends on bugs and antibiotic sensitivities, and whenever they get that chance to culture and do a sensitivity, they might pick a specific antibiotic this time, whereas they might pick another one the next time. Just depends what they're going to do. It's nice to have that, but so an antibiotic is one of those things that we like to have direction on, but we don't always. So we may just kind of randomly pick one initially and see if it's going to work. Next thing, I've seen procedures where the biggest thing is getting them out of the sun, protecting that eye. It hurts as long as that sun's beating on them, so we may glue a patch on.
Get the irritants, the sun, the flies, the dust, get it off of there.
Protect them. So I've seen patch glued on. I mean, there was a time when I was cutting out old Levi's to make patches that we could glue on the eye, and also prevents flies from getting on that and going to the next one. I've seen other situations where we're injecting penicillin near around the eye and then covering it with a suture. So that's another method that you might have seen, or any of the people out there might have seen their veterinarians do. Depends on facilities, what you have to work with, where you're at, and how you're going to treat those. But it's nice to get on it and have a direction and stick with it, and make some scientific choices through the course.
Any preference for you, systemic versus the localized injection of antibiotics?
Well, everything that I've read has shown that either a systemic antibiotic, there's a couple mentioned, or the locals, the duration of the disease is about the same. And most of the big studies looking at overall cure rates and time, they're all about the same. One thing I do advocate is an anti-inflammatory, though, because those eyes hurt.
What would be some examples of anti-inflammatories that you...
Flunixin, Banamine, and I've even seen dexamethasone or steroids used, depending on how bad they are.
Just to help with the pain of the eye and reduce the inflammation around that cornea.
Right, and some of them get bad enough that they get beyond treatment, and then at that point it's probably a good idea to take the eye out. So we've had to go that far too.
So antibiotic, systemic or local, get an anti-inflammatory, and if it gets bad enough, we may have to remove the eye.
Right. Yeah.
Great. We're going to take a break. When we come back from the break, we're going to talk about ways to prevent pink eye from occurring in your herd. Dr. Matt Meisner has joined me today. You're watching Doc Talk. We're sure glad you joined us. We'll be back in a minute.
The BQA tip of the day, sponsored by Beringer Engelheim Vetmedica Inc.
Hello folks, Dr. Nels Lindberg here from Great Bend, Kansas with Production Animal Consultation and Animal Medical Center. Today's BQA tip of the day, we're going to talk about pen surface management. And pen surface management doesn't just have to do with feed yards, it has to do with cow-calf producers that have any sort of pens, stockers, starter yards, and feed yards. We all need to do a great job of taking care of our pen surfaces. We can often forget about them. We have many other things to take care of, but again, we want to maintain an excellent pen surface for these cattle. It's good for their welfare, it's excellent for animal health, and if we don't take care of them, can also negatively impact animal performance. We must groom these pens periodically. Pen populations, how often cattle are in them, will often dictate that. Bedding cattle will dictate that. If we're feeding them big round bales and pens, will dictate that. But again, we want to have a clean, dry pen surface for these cattle. Whether it's a cow-calf herd and baby calves, feeder cattle, stalker cattle, whatever it may be. If we have a lot of buildup, whether it's manure or feed particle or bales, bacteria, viruses sit in there and they continue to cohabitate and infect new cattle or the same cattle or baby calves, creating unhealthy situations for all the animals. Let's do the right thing, take care of these pen surfaces, groom them frequently, and make them look like this pen right here. Thank you much.
it must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones, all they want to do is go to the barn, swing a rope, and be a cowboy. It's something, it's a lifestyle that we have, the way we make a living, obviously, but it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there, folks. Welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Matt Meisner from the Veterinary Health Center. He's a boarded large animal internal medicine specialist, and he is an associate clinical professor. And we have been talking about pink eye, and it's something that happens in all the cow herds, and we've gone through the causes, the bugs, the ways to diagnose it, treatments, and now we're going to talk about prevention. And I told Matt during the break, I said, we better start out with vaccine, because that's the one everybody's going to want to know about right off the bat. And what are some of the general thoughts or opinions on vaccinations?
I think that the general thoughts is, they wouldn't be there if they didn't have some benefit, and I believe they do. And then there's also the vaccines that we have that we can culture that bug. You can send it into a lab and have that bug made into a vaccine, meaning an autogenous vaccine. And I've heard all of those used. And then on my side, I kind of look at the evidence and try to figure out, is it a cure-all? No, it's one of these bugs that can change so readily within an outbreak from year to year, from herd to herd. There's a couple of different bugs that they're actually questioning now. So it's pretty wide. It can help. I think what we've pretty much consensus is if you use your vaccine and it's not really cutting the mustard, you might spend more of that money on some other preventive measures, which we get into secondly. But the vaccines, they're there. They're a good tool. Use them if they're not working. We need to kind of focus on the other 5 or 6 different problems that
might make a little bigger difference.
Because treatment is a nightmare. It's one of those, when you get into a big mess, it is a lot of labor and a lot of work and a lot of frustration. So prevention is the big key here.
What are some of the other, we talked about the irritants. What are some of the other things that we might do to kind of prevent?
Sure. So, the irritants being grass-awns and dust. So we can limit dust if we have the ability to keep moisture on the ground in pens. We can mow the seed heads off the pastures to limit all the grass-awns that could get in there and irritate the eye. We can have shades just to keep that under control. UV light, fly tags, different things, fly preventions. Those are huge. And if we can get all those added up in an efficient way, I think we can limit it a lot. I have clients that will start mowing pastures here to limit their exposure and kind of irritants for pink eye. They've had it in the past, and that's one thing that works to limit it. And so,
well, I've even seen some deals on fly control that'll be coming out. That fly control delivered in a paintball gun. Yeah. So it could be kind of fun that way to get rid of flies in here.
You know, and then lastly, I think good nutrition. You know, good strong nutrition, keep them healthy, keep their immune system going. You know, trace minerals and overall energy. I think we'll keep them healthy.
Well, appreciate you being here today.
Sure.
Appreciate you joining us too. If you want to know more about what Dr. Meisner and I do here at the College of Veterinary Medicine at Kansas State University, you can find us on the web at www.vet.ksu.edu. And remember, we always recommend that you work with your local practitioner. You've been watching DocTalk today. We've been talking about pink eye. We're really glad you joined us. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.